This is Dr. Noman Siddiqui going through the TraumaCad presentation on foot and ankle deformities and how to utilize this program to correct various foot and ankle conditions. We're going to start off with a relatively easy example and one that the program lends itself very well to. In the screen you can see is a AP foot, right foot that has a Hallux valgus deformity. The first thing the person utilizing the program needs to do is bring up the picture by double-clicking on the image itself. Once the image is in the screen, as the person selects the next screen, there are various options that come up. Obviously, for our focus, we're going to choose foot and ankle, and by doing that, there are certain prompts that are required before one can move forward. First of which, if you pay attention to the left side of the screen, the image itself, as I mentioned earlier, is an AP foot, and we are working on the right side. The next most important feature that needs to be done before any correction can be performed on this program is calibration. The metal ball calibration, which you see in the image and which the system automatically recognizes, has been set to 25.4 millimeters, and that's what this ball is, and it matches up really nicely. And this, once we set this, will make this system very accurate to calculate osteotomies, lengths, and anything that we would like to do. So this is the most important step. So we're going to accept this, and once that is done, we are now ready to do deformity correction. Once you have calibrated your image, the left side of the screen will show various options. Within them, the first one is the foot osteotomies wizard, and we will go through that one, but I will highlight the other options that show up. Obviously, when you're dealing with the bunion deformity, you have the Hallux valgus angle, and as you scroll over each heading, on the bottom there's an image that pops up that tells you what you're actually going to be measuring. So obviously the first one is the Hallux valgus angle, which measures the deformity between the first metatarsal and the proximal phalanx. The next is the Hallux valgus interphalangeus angle, which measures the deformity between the distal and proximal phalanx of the great toe. Secondarily, the intermetatarsal angle, which is measuring the distance between the first and second metatarsals, followed by the distal metatarsal articular angle, which is the effective articular surface of the distal aspect of the first metatarsal, followed by the proximal metatarsal articular angle, which is the proximal metatarsal articular surface and the cuneiform itself. And then finally the talar tilt, but in this image we don't have to worry about that. Now, going back to the foot osteotomies wizard, what does this do? When one selects this, there are certain options that come up. In this image, we're only working on one foot, so we're going to select unilateral. And the program, it nicely guides you through certain points that allow you to obtain some of these measurements. So why don't we go through that? If we look here, it corresponds to the image all the way on the left on the drawing, and I can highlight that for you right over here. If we select the proximal aspect of the first metatarsal, that's number 1. And then you just go through it. 2, 3, 4, and this is actually interesting. This is the articular surface that you're highlighting, and you can kind of see in this that I'm effectively choosing this articular surface here. Moving on, I select all my data points so the program can start measuring the angles. And these aren't set in stone. These can be adjusted later, and the program can do that. If you're not happy, like I'm not with this line right here, I can kind of always go back and adjust it to make myself feel a little better. But by and large, this is a relatively easy way to do it. And then if you look back over here, you can start seeing that we have certain measurements. Our Hallux valgus angle shows up as a 37-degree angle. Normal measurements are noted to the next column, which would be 15 to 20 degrees, so clearly we have a Hallux valgus deformity. And then if you evaluate the other angles, the intermetatarsal angle and the distal metatarsal articular angle is also normal, 5 degrees, and that shows up. And that's why at this point, now that we know that the hallux valgus angle is the predominantly incorrect one, that's what we're going to focus on correcting. But those of you that do bunion corrections know that the hallux valgus angle can be corrected in two ways. One, it can be done many ways, but one of the ways that it can be corrected is strictly an osteotomy of the proximal phalanx and some soft tissue balancing, which allow for correction of this bone over the first metatarsal, or a combination of proximal phalanx with soft tissue as well as a distal metatarsal osteotomy, which allows for correction of this deformity. The key features of the program that help in planning purposes is one that I like to use is whether or not after I make an osteotomy will I be able to translate the amount of bone to get the correction I need. So if we just take away some of these lines here for a second and just ignore them, that they're out of the picture, we can start looking at those features. One of the key features of hallux valgus is this feature of sesamoid uncovering. And you can see here the fibular sesamoid is starting to get uncovered. So in this case, I would like to plan out how much metatarsal shift I would have to perform to get the head of the first metatarsal to cover this sesamoid. And if you look up on top on this toolbar, there are various tools that can be helpful with that. So obviously the one that says ruler would be the most beneficial. And we would select that tab, and then I would start on the lateral aspect of the metatarsal and then measure out exactly how much head translation I would need to cover this whole sesamoid. Because in hallux valgus correction, the sesamoids, once they are in a better position, allow for better function of the great toe joint. So as we see, we need to move our head of our metatarsal, if we're doing a distal metatarsal osteotomy, 7 millimeters to get that correction. And commonly, when people perform this osteotomy, they tend to remove the medial eminence, which is right here. So if we just measure out our metatarsal, we know our head of our metatarsal in total is about 16 millimeters. And by removing the medial eminence, we would remove approximately, if we measure that, 4 millimeters of that. So if you take 16 millimeters, if you subtract 4 millimeters for about 16 millimeters, you're left with about 12 millimeters of metatarsal head that needs to be effectively transferred over. So that tells me that I would have that much metatarsal still left after removing the medial eminence to cover the fibular sesamoid. So that's just a little bit of, if you're using this method to teach residents or other practitioners that are learning how to do this, this is a very good tool in what they can use this tool for evaluations of their metatarsal deformity. Secondarily, what I also use this tool for is also to let me know how to make soft tissue correction and how much soft tissue correction I need to make. Even though we're measuring bony deformity, this program is very helpful in soft tissue evaluation as well. So, and I can show that to you as we make the correction itself. So let's delete this measurement. So first thing first is I'd like to identify certain angles again. And instead of having all those lines, let's just draw our hallux valgus line. But instead, let's just keep those lines in between. And I'll go through how I got this image to show up. On your toolbar up top where you are, there's a tab that says interline angle. When you click that tab and then click it on the screen, and the system automatically populates two lines and shows the angle that's associated with the intersection of those lines. That is a very nice instrument in using, it's a nice way to monitor correction without having all those lines that extend out of the bone. Because if you use the other method, the system does not respond well. So I always like to keep my lines within the bone that I'm correcting, because then they also correct when I do my deformity correction. So let's just remove that last one and keep these. So here's our hallux valgus angle. We said it was 33 degrees, and we may have said it was something else earlier, but when we put our lines in here, using the anatomic shaft bisection of the metatarsal and the proximal phalanx. It comes out to 33 degrees. The next thing I use is this tab, which is the Define Fragment tab, and I define both my fragments. So I like to create a lot of data points because that makes it easier to grab bigger pieces, especially around articulations. So we're going to correct the great toe. So I'm going to select that. That's one. I'm going to click it again and define my next fragment, which is my metatarsal. And since we said we're doing a distal procedure, I'm just going to select the head of the metatarsal. And we're going to keep it right at the level of the neck and no more. And so now we've selected that. So first things first, I'm going to see if I can translate this head of this metatarsal enough to cover the sesamoids. And since we measured out that we need to do about 7 millimeters, we should be able to do that pretty easily. And as I do that, you can see my hallux valgus angle is decreasing. So as I move this over, I can translate this as much as I want, but after a while, you're going to lose bony contact. So let's just say we're going to transfer it over. Realistically, when you do, say, a chevron osteotomy or even a transverse osteotomy, you would move it about 50, if not, maybe even for the more adventurous type, to 75% of the correction. After a while, you're going to run into the second metatarsal as it is. So say we moved it about 50%, and that's where we are. We're happy with that. Many times when you've done that, now you have to correct the hallux portion of it, and commonly a procedure that's done to correct the hallux is a lateral release, which is a soft tissue procedure. And what you would do then is select the hallux, and when you select that fragment, which includes the proximal and distal phalanx, there's a red circle or like a bullseye that comes up in the center of rotation of that fragment. The hallux, obviously, if you try to rotate it, does not rotate around this point or this bullseye. So we have to pick a point where this can rotate around. And as you know, since the proximal phalanx articulates with the head of the first metatarsal, the best point to choose would be right about the center of that head of that first metatarsal. And now if we rotate that, we're able to correct even more. So let's try to see where we were. We were at about 22 degrees, and as we keep going, we're reducing that angle to a more normal position. And as we said, that normal hallux valgus angle is about 15 degrees to between 15 and 20 degrees. We want to make this not super straight, but relatively straight. And now we've corrected it to 13 degrees. And then we select our image. This is, if we are happy with this, we've planned out that we would have to make a shift of about 7 millimeters, which corresponds to the amount of fibular sesamoid uncovering. And we're going to correct from our preoperative hallux valgus angle of about 30 degrees to about 13. And this is one of the simpler ways to use this program. It's very effective in teaching and can tell you that your soft tissue correction should, combined with your bony correction, should get you a more rectus, normal looking foot.